Hi, I'm Kimi Nishimoto, and I'm a dental hygienist and myofunctional therapist. And today I just wanted to do a quick lesson on how to identify if someone might have a myofunctional disorder. Most of the patients that are going through expansion, the DNA appliance, orthodontics, or have sleep apnea or some sort of sleep breathing issue, they likely have some sort of myofunctional disorder. Myofunctional disorder just means there's some disruptance in normal patterns and behaviors and muscle function. For example, I have had a tongue tie my entire life. Just had it released in September, and after the surgery was really, really tight and very swollen and sore. And my tongue tie, I didn't notice as much until after my surgery, and everything was so tight and swollen. It was almost like having a really severe muscle dysfunction because of the tongue tie surgery. But as things are getting better and I'm working on the muscles and have learned to stretch and massage them on myself, it's getting much better. So let me just jump into it on what a myofunctional disorder is. So I'm just going to run through these things that you can look for in patients or in yourself or children. Mostly I just wanted you guys to know what to look for in patients. Thumb sucking, lip licking, biting, chapped lips means that they're probably licking or biting quite often. Sloppy eating, food around face or plate, nail biting, cuticle biting, chewing with the mouth open, lip smacking while eating, food and texture aversions, improper swallowing, using the lips to swallow, tongue thrust, which would look like this, or sometimes it'll go out the side, or bobbing the head to swallow. When I first had my tongue tie surgery, I had to use my whole head to swallow because I was so swollen. Clenching and grinding, this is often really overlooked, but clenching and grinding a lot of times is muscle dysfunction due to a tongue tie, and then grinding is an airway problem because they're moving their jaw to open up the back of their throat. Or if they have chronically sensitive teeth or breaking teeth, mouth breathing, or resting with the lips apart. Sometimes they don't realize they're mouth breathing, but if they are resting with their lips apart, you're going to be breathing through that mouth. Whatever hole is open is where you're going to breathe through. Tongue tie, which is under the tongue. Lip tie, which would be under the upper lip up here. And then buccal ties, which are in the cheeks, usually near the premolar area. Tmj pain. Sometimes it will also radiate up their temples. SCM, the very back of the neck, forehead, and around the eyebrows. Open mouth resting. Sometimes it's subtle though. The lips will just barely be apart, or it could be the full on. Low tongue posture, the floor of the mouth or behind the bottom front teeth. Lip wedging, tongue wedging, or cheek chewing. You'll usually see cheek chewing and tongue wedging. They'll have like white lines around their tongue and their cheeks. Drooling during the day and drool on the pillow at night. Sucking habits or chewing habits, especially clothes or objects. Nighttime teeth grinding, snoring, sleep apnea, sleep disordered breathing. Holding the lower jaw out so teeth are edge to edge, or lower jaw positioned retrognathodically. So either the jaw is too far, bottom jaw is too far forward or too far back. So an exaggerated version, that, holding it edge to edge. you're trying to open up the back of your throat. And then if it's retrognathic, typically people who mouth breathe look like this. Jaw drops back. Chewing on the tongue, hair pulling, or any sort of OCD type habit, sometimes like twisting the hair or pulling the hair out, especially in young kids. Crowding, cross bites, open bites. Open bites happen from the tongue forcing its way through about 1,000 plus times a day. It will open up the bite. So usually they swallow like this, using the teeth to swallow. Palate shaped like a mountain, not a hobbit hill. An ideal palate's kind of round and flat. Dark circles or bags under the eyes, it's called allergic shiners or venous pooling. Just means that there's a lack of oxygen flow there. Bedwetting, over-breathing, sighing, shallow, anxious chest breathing. If your upper chest moves when you're breathing, your bottom half of your lungs is not engaged. Upper chest breathing is fight or flight. It's your stress mode. Loud whistling nose breathing or stuffiness. Sniffling nose or like chronic congestion or a history of sinus issues, allergy issues on their medical history. Chest and shoulders moving when breathing. Weak tone to cheeks and jaw. So typically it's like kind of that long, narrow face, or the cheeks just look kind of sallow, a little sunken. A weak chin would be more like dropped back. A prominent chin is more forward. Weak jaws or a very prominent jaw. A lot of times mouth breathers, you can see more of their bottom lip because it will roll out, and the wet line shows when resting. So if they're mouth breathing, this is the wet line right in here. That will show more. Tongue visible during speech. A lot of times you'll see this with S's or with D's and L's, like LOL, LOL, roller coaster. Speech impediments are also very common with tongue ties. The tongue is a pain in the neck to clean their teeth or work on them when they're in the dental chair. It's big, it's difficult to retract, it's bossy, strong. Sometimes with thyroid conditions, it will get larger from the swelling. The jaw deviates to one side when opening, so when you ask them to open and close, it's swinging one way or the other, like my jaw's behaving itself today. Usually it will really deviate. There we go. It swung this way. TMJ is tender on one or both sides. Clicking, popping, or noisy TMJ. Headaches, phantom toothaches, where they're having pain and it feels like a tooth problem, but it's actually usually clenching, or the muscles are sending referred pain to the teeth. Neck pain also very common. If people have a tongue tie, their tongue is limited on how much it can move without pulling on other muscles, such as if you're telling them to put their tongue in their cheek and their jaw has to move with it. That can pull on muscles. Even silly things like swallowing, sometimes you can use your muscles in your neck too. Ringing in ears and earaches with no infections. Also, people that are tongue-tied are more likely to have chronic ear issues, sinus issues, tonsils and adenoid problems, or have a history of having those removed. Poor home care because the lips aren't cleansing the buccal surfaces and the gums can look shiny. Sometimes the teeth are dirty or have a lot of plaque near the molars because tongue-tied people have a lot harder time reaching their tongue up there. Gum disease, persistent gingivitis and periodontal disease, mobility, recession, and recession on teeth not in occlusion, common with people with a tongue thrust. Their tongue is pushing into their teeth 1,000 to 1,500 times a day when they swallow. Pushes the teeth out. That pressure can cause bone loss and recession on those teeth, even if they're not touching at all. Strong gag reflex, chokes on the water when we're working on them, has a hard time gargling, sensitive or ticklish palate, sleep medications and sleep issues, inflammatory and autoimmune disease. Their jaw can sometimes have a limited opening because they have so much muscle fatigue, or sometimes discs will displace if they've had like trauma there, or if their jaw has dislocated and they put it back in, sometimes that will really inflame that disc and they'll have a limited opening when they open and close. Large tonsils and adenoids or history of removal. We can't see the adenoids, but we can see tonsils. So if you see a child, teenager, adult, and you're looking at their throat, having them say ah, and you see their tonsils, pretty good chance that they're mouth breathing and they need therapy to learn to breathe through their nose. Noisy breathers. It's not quite snoring, but it's also not healthy breathing either. Recurrent nightmares. Sleep sweating. Open mouth when sleeping. So during the day they may say, oh no, like I totally keep my mouth closed all day, but at nighttime they might be, their lips come apart, and if the lips come apart, we're going to breathe with our mouth. Difficulty waking up and not feeling refreshed, moody, behavioral issues, aggression, ADD, ADHD, memory issues, brain fog, and Alzheimer's is linked to sleep disordered breathing as well. Especially younger people, like nose picking. If they're picking their nose a lot, they probably have allergies. And if you have allergies, you're going to be more likely to have congestion, which makes it hard for you to breathe through your nose, so you have to breathe with your mouth. Skin picking, eyebrow picking, skin biting, kind of those nervous anxiety tics. Frequent throat clearing, hoarse throat, cough with no illness. This is associated with silent reflux, which is when we're sleeping. A lot of times, if the tongue falls back into the throat, in the airway, that will cause a suction effect to pull acids up into the stomach, into the throat. So these people may not think they have any sleep apnea or they have any sleep acid reflux in their sleep, but the frequent throat clearing, hoarse throat, cough with no illness is associated with silent reflux. I have had hiccups for I can't even remember how many years, and I would not be surprised if I have silent reflux because I've had sleep disordered breathing my entire life. Acid reflux, constipation and diarrhea. If you can't properly chew due to a tongue tie or you have low weak tone in your cheeks, you're not going to chew food as well, which is going to cause digestive problems. So we do myofunctional therapy because the muscles have memory and they will just continue doing what they've always done. We need to retrain the habits and compensations for whatever is limited in the mouth. Teach them to move independently of each other without engaging the other muscles until it's second nature. And it takes quite a while before it becomes that second nature. The tongue and lips are natural retainers, so we want them to be functioning properly and not working against you. That's why it's really important to do myofunctional therapy with orthodontics, sleep apnea, and with the DNA appliances when you're doing the expansion, because you want the tongue to be doing the job when the appliances aren't in. And getting that muscle memory during the day, so then at nighttime it's second nature. We also need to train our tongue to be suctioned all the way up into the palate, not on the floor of the mouth. Almost all of my patients that I see in my hygiene chair, I ask them where their tongue sits. Almost everybody says behind their bottom front teeth or behind their upper front teeth, but we're actually not supposed to use our tongue on our teeth. Our tongue should be entirely filling the palate. So how that would look is you would put your tongue on the incisive papilla, the little round piece of gum behind your upper front teeth, number 8 and 9, and then say N. So that's the start of the suction, and then you just push the rest of the tongue up so the whole thing fits into the palate. And then you'll rest lips together, tongue suctioned up, and breathing through the nose. About 1 millimeter of space between the teeth. If you aren't quite sure where someone's tongue is resting, if you look at them from the side and you see a double chin, I'll put my tongue low here. Right here, double chin. And you click the tongue. You can see how under there it's moving. That's because the double chin, that we call it, is actually the base of the tongue. So if someone has a pretty prominent double chin, they probably have low tongue posture, and they could benefit from myofunctional therapy. If the tongue is low, most likely they're getting an impingement in the airway as well, because most of the tongue lives in the throat. So we want to teach them to suction their tongue entirely up in the roof of the mouth. That will open it up back there. The other purpose of myofunctional therapy is to balance out the musculature. Not engaging neck muscles or jaw muscles when we're moving our tongue. We're also teaching them to create what's called lip seal, which is lips together all the time, but not exerting a lot of force to keep the lips together. Just a nice resting posture. We're also going to be correcting improper swallowing, which includes tongue thrust, using the teeth to swallow, or having to use the lips and face muscles to swallow. So there's a couple ways of testing it. You can use an air water syringe or a spray bottle and squirt it on the tongue, and then just watch how they swallow. I'll show you a good swallow and then some bad swallows. No movement anywhere except for my tongue. This is using my lips to swallow. You get the littlest wrinkles, or sometimes a little pursing of the lips. Sometimes people with a tongue thrust, you can't see it because they may not open their mouth. Sometimes they'll lick their lips as soon as they're done swallowing, such as this. Which is still dysfunctional. So in that case, we would train them to swallow and not lick afterwards. And some people engage their neck muscles. Pulling right here. Let's see. And then we're also really focusing on nose breathing, keeping your mouth closed, and opening up those nasal passages. The more expansion that they're doing with their DNA appliance, the more that their nose is going to open, and expanding that nasal cavity is going to help as that palate drops and widens. But you can, if they're not nose breathing, it's not as effective. So if you can get them to nose breathe and keep their tongue up there, it's just going to work much better, much faster, and give them more benefits. Let's see. So things that you guys can do to screen in the chair is I like to just see how they swallow. The other test I do is I will squirt onto their tongue, hold their lips back and their cheeks back, and have them bite down and swallow. If I can see any of their tongue, they have an improper swallow. If they're using their tongue on their teeth or finding spaces in their teeth, it's a tongue thrust. It may not be that classic, but it's still tongue thrusting. It can cause problems, and you're engaging muscles you're not meant to. So what that would look like for a proper swallow. No movement anywhere but my tongue. I'm using my tongue to the tip of the incisive foramen and putting my tongue up to get the suction to swallow. People that tongue thrust, when you do this, you'll see their tongue kind of squish out. Sometimes it's really subtle, so I'll put some more water on there and have them do it again. Tongue thrust. Sometimes it will squish out the sides. Something that I've noticed is if somebody has a strange little space in their occlusion when I'm looking at their bite and I do this test, most of the time the tongue is finding that little space and going there to get some suction to swallow. So really working on not doing that is a part of the myofunctional therapy. I think you guys are going to be doing frenectomies in the office. So things to look for. When they open their mouth as big as they can, I'll usually hold their jaw, their bottom jaw, with my finger, and then have them open as wide as they can, hold it down, lift their tongue up to the roof of the mouth, and tell them not to close down at all. Just lift it as much as it can without biting down. That's a really good way of seeing that tongue tie. Sometimes if you don't hold their jaw down to their max opening and then have them lift it, their jaw will move and go up. So then you can't quite tell. So an example of that would be max opening with the tongue to the incisive papilla. Okay, so I can do that without moving my jaw, but with patients what you'll do is this, max opening, and then tongue up as far as they can without the jaw closing down at all. That's a good way of seeing the tongue tie. A lot of times it looks like they can get their tongue up there pretty well, but the whole floor of the mouth has to lift to compensate for it. So you can mention it to the doctor. I suspect, or do you want to look at the tongue tie? And if he sees that compensation, he or she sees the compensation, they can always hold down the floor of the mouth and see how far it can lift to the palate without activating the floor of the mouth. My tongue tie, no one ever found it on me because it looked like I could move my tongue just fine. I had no major speech impediments, but the whole floor of the mouth had to lift for me to lift my tongue up. So tongue ties also can look heart-shaped when it's lifted, V-shaped, or kind of oblong. It should be kind of pointy without any indentation right in the center of it. Also, tongue ties can have like a really deep, prominent groove on the top of the tongue. Even after my tongue tie surgery, I still have that groove. Let's see. Or they have like a really high gag reflex, like their gag reflex is pretty strong. Yeah. You can always email me or call me with any questions on that. But if you guys identify the tongue tie, tell me if you are wanting to do frenectomy on it. We need to start therapy first before at least a couple months, and then do the surgery, and then several more months of therapy after to retrain those muscles. I'm about a month and a half out from my frenectomy surgery, and I still have a lot of tightness. It would probably be really bad if I hadn't done any therapy before and after. And I have a lot of muscle compensations because of how tight it is. And even with all of my hard work, I know I'm getting scar tissue. So this is what my tongue tie looks like now. That thick band in the middle is scar tissue. It's very tight. I can still feel the anterior attachment, but it's better than it was. Before I had my tongue tie surgery, I grinded my teeth every single night since I was a small child. Restless. I'm a kicker in my sleep. I did crocodile rolls in bed. I have a king-size bed. I end up all over the place. Snore. My sisters would get really mad at me because I'm bad to share a room with. Dark circles under the eyes. Constantly exhausted. I also struggle with anxiety and depression, which is common with that. If you're always not getting enough rest, you're in fight or flight mode. So the tongue tie surgery has helped me a lot. I'm able to sleep through the night. I'm not waking up choking or gasping. My nightmares I've had every single night since I was a little child are basically gone. I have nightmares every now and then, and I do wake up and I feel like I haven't been breathing or I've been snoring, but it's much, much, much better. So I definitely believe in it, and I know that it's really important. I would just encourage you guys, if you're going to be doing frenectomies, definitely send them for myofunctional therapy before and after, just to prepare the muscles, prepare the neuromuscular. It's like you have to get your brain to connect to that area, isolating the muscles, so then after it's released, then it has a better chance of knowing what to do. The exercises are not super uncomfortable before the surgery, but after the surgery, it's a little uncomfortable. So you need to be used to it so you're not babying it. Alright, I hope that helped, and please send anyone that you're concerned about or that you think would benefit. Thank you.